The thing is, Dr. Harry, that I've been applying the ointment to the scab twice a day, as we discussed. But instead of melting away, as I expected, the scab has simply come off.
Yes, I see.
As a matter of fact, I've got it with me. Look, here it is.
Oh.
Would you like to look at it a bit more closely?
No, that's quite all right.
But the question is, Dr. Harry, should I keep applying the ointment?
Do you still have any symptoms?
I sometimes feel quite light-headed before I've had my breakfast.
No, Mrs. Hattersley. You should continue with the ointment if you still have dry, itchy, flaky or scabby skin.
So, I should apply the ointment twice a day?
Yes.
To the scab.
To the scab? No, Mrs. Hattersley, no, not to the scab. The scab has come off.
Oh, I see.
The ointment is for your skin, where the symptoms are.
But what about this scab?
What about it?
What shall I do with it?
Well, I suggest you throw it away.
Would you like to send it for analysis, Dr. Harry?
I really don't think there's any need for that, Mrs. Hattersley.
Oh, well, in that case, I shall simply add it to my scab collection.
Oh, good. Well, Mrs. Hattersley, if that's all...
Well, just before I go, Dr. Harry, as the subject of my scab collection has come up, I've been meaning to have a little chat with you about it.
Oh, well, as long as it doesn't take too long. I've got several visits today.
Oh, I know, you must be ever so busy. I'm sure you've got much more important things to think about than a silly old lady like me and her extensive collection of scabs.
It's not that at all, Mrs. Hattersley.
Tell me, Dr. Harry, I'm not getting any younger, and I should like to make a contribution to medical science when I go. To which of the major London research hospitals do you think my scab collection should be bequeathed?
Well, Mrs. Hattersley, this really isn't my area of expertise. If you were to have a look on the internet...
Oh, please don't say the internet.
Well, if you just put it in on Google...
Oh, please don't talk about Google. I'm an old lady. I don't understand these things. Just the mention of them makes me feel all muddled. But a clever young doctor like you, on the other hand, I'm sure you could have a look and find out as quick as a flash.
The thing is, Mrs. Hattersley, I really don't have all that much spare time.
Oh, I know it's an awful lot to ask, and I'm sure you prefer to concentrate your energies on younger patients sooner than waste your time on a silly old thing like me.
No, Mrs. Hattersley, that's not the case at all.
Like that time you didn't come and visit me when I turned out to have pneumonia.
Now, come along, Mrs. Hattersley. I explained to you at the time I'd accidentally booked you in for the following week.
That nice consultant at the hospital said I was lucky to be alive, but of course I do realise you had more important patients to worry about.
All right, Mrs. Hattersley, I'll have a quick look online, but I really can't make any promises.
Oh, you are kind. I'm sure you'd much rather be having a nice buttered scone or an erotic massage.
Dr. Underslider's here to see you, Dr. Harry.
Come in, grubber.
All right, Harry, how's it going then, mate? All right?
Ugh.
Here, you got any hepatitis A injections I can borrow? I'm expecting a delivery, only I'll pay you back next week.
Whatever.
And couch rolls, you haven't got any couch rolls you could spare, have you? And examination gloves, I'm always running out of them. Only I'm a bit behind on my ordering this month, so I'll pay you back.
Help yourself.
Thanks, mate. I'll pay you back this week or the week after.
Just ask Tina.
Oh, yeah, Tina. She seems like a nice girl, that Tina. Stays behind late some nights, does she? Oh, yeah, I'll bet she does. Shouldn't think she's averse to a bit of overtime now and again, now, Tina. Yeah, well, I'll just... Yeah, I can't help noticing you seem a bit down in the dumps. A bit fed up sort of thing.
I'm sorry, Grabber.
Patients getting on your tits, are they?
Well, there's one patient in particular.
I know what you mean, mate. I know exactly what you mean. Some stuck-up git who works in London, is it? Poncy barrister or something, I expect?
No, it's an old lady.
Oh, bleeding hell, they're the worst. They are the pits, they are.
There's no real harm in her, it's just...
What is it, no teeth? Deaf as a post? Keeps farting all the time? Smells of dry piss?
No, it's just she never listens to anything I tell her.
Yeah.
and she always somehow manages to manipulate me into doing things I really don't want to do.
Yeah, mate, yeah.
Which I know perfectly well are going to be a complete waste of time.
Mate, I've been there. She's a classic case, absolutely classic. I've got patients just like that. Know what I do with them?
What?
I'll tell her what I think of them.
How do you mean?
I say, hold up a minute, dear. Do you realise you're completely wasting my time and getting right on my knob?
No, you don't say that really.
I bloody do. I'll give it to them straight, I do. I say, stop talking bollocks all the time and listen to what I've got to say for once.
God, wouldn't that be great?
It is great, I can tell you. And what's more, it really works. It's an accredited technique. I read a book about it.
Oh, it sounds absolutely brilliant. Oh, but I can imagine what would happen in real life. She'd skewer my testicles with a hat pin.
No, you'd be surprised, mate. You really would.
Well, I suppose I could... I suppose I could... No, it would never work. It would end in disaster.
Well, you're missing out, mate. I'm telling you, you really are. Now, where's them hepatitis A jabs? Hello? Oh, hello, Mrs. Prolapse. How are you? Oh, dear. Well, can't you just pop it back in like you did last time, dear? Oh. Oh, well, never mind. Now I can't be long, because I've just made my breakfast and left it out on the table. Oh, you know, just a boiled egg and toast cut on the slant. I always think that makes such a difference, don't you? And tea with a wedge of lemon. Oh, and of course, all of my morning tablets set out on a saucer. Some good news about my collection, though, dear. You know, my scab collection. My GP, Dr. Harry, is going to find out for me which of the London research hospitals would care to take it. Oh, no, I'm afraid you'll have to ask your own GP about your toenails, dear. There's really no need to be shy. I always find that Dr. Harry is only too pleased to be of help if one approaches him in the right way. Now, I really must be going, dear. Yes, goodbye. A silly old bat. Who could possibly be interested in that revolting collection of old toenails of hers? Oh well, breakfast, here I come. Channels! No! It's Mrs. Attersley for you, Dr. Harry.
Ah, Mrs. Attersley. Come in. I'm rather glad to see you, actually, because I've been doing a bit of research, and rather to my own surprise, I've managed to find a home for that collection of yours.
Oh, how exciting! How clever you are! I do hope it didn't put you to too much trouble.
Well, it did take quite a long time, but I got something in the end. It's a place called the Scab, Bogey, Vomit and Pus Archive. It's in Maidstone. I've printed out the details.
Oh, Maidstone. I see.
Here we are. There's a telephone number there for you to ring.
And I would have to ring this telephone number myself, would I?
Well, yes, or you could write to them. There's an address on there as well.
And I would have to write to them myself, do you mean?
Well, yes, Mrs. Attersley, you would.
Well, it really wasn't all that important. Now, what I really came to see you about today was my cat.
Your cat?
Yes, you know, Tiddles.
Go on, tell her what you think of her. She's taking the piss. Say to her, you're taking the piss, ain't you, darling?
No, I don't think that's a very good idea.
Don't think what's a good idea, Dr. Harry?
Oh, nothing, Mrs. Attersley.
Well, as I was saying, about Tiddles. You see, every morning I set out my medication on a little plate, alongside my boiled egg and my slice of toast, and my morning cup of
Tell her to bleeding well, get on with it. Go on.
tray, and sit with the tray on my lap while I watched some morning television. Of course, I used to listen to dear Terry Wogan on the radio, but he isn't on anymore.
Tell her she's boring the tips off you. Go on, tell her.
No, I don't think that would help.
You don't think what would help, Dr. Harry?
Nothing.
Well, will he be all right, Dr. Harry?
Who? Terry Wogan?
No, Tiddles. Will he be all right after eating my tablets?
Well, that's really more of a question for a vet, don't you think?
Oh, please don't say a vet, Dr. Harry. Vets charge such a terrible lot of money. I'm only an old lady, and I really haven't got very much put away.
Call her a stupid old bag. Go on, tell her she ought to be in a home.
I did think, if you didn't know the answer yourself, that you might ring up the vet and ask on my behalf.
Go on, punch her in the face. Punch her right up the hooter.
Look, for goodness sake, will you shut up?
Dr. Harry!